right, so now I just want to jump into this because I know that everyone's pretty anxious for phase two. I'm going to just gives me great pleasure to introduce our expert speaker, Margaret Foster. If you were with us last month, you got to enjoy that presentation. And today we're going to talk about phase two protocol. Margaret Foster is the Evidence and Synthesis and Scholarly Communications Librarian and the head of the Center for Systematic Reviews and Research Synthesis at the Medical Sciences Library, Texas A&M University. She is the co-author of the first book written on systematic reviews for librarians, Assembling the Pieces of a Systematic Review, a Guide for Librarians, and recently Piecing Together Systematic Reviews and Other Evidence Synthesis. She received the Presidential Impact Award from Texas A&M in 2018 and the Lucretia W. McClure Excellence in Education Award in 2024 from the Medical Library Association. So thank you so much, Margaret, for being our guest speaker for the series. We're so excited about it, and I know that our attendees are as well. So right now I'm going to stop sharing my screen and hand everything over to you.
So good afternoon, everyone. You may be able to tell from my voice, I do have a really bad cold right now. So hopefully we can get through today and I won't lose my voice, but I didn't want to miss the opportunity to talk with everyone. So today's objectives are we're going to be going over the protocol. We're going to be talking about what are the requirements of a protocol, why should you register, talking about selecting databases for the search, beginning that discussion on developing the main search, and then talking about the steps that happen after the search that needs to be developed to complete the protocol and before moving on to the next stages. So I've divided up today into 6 parts. We're going to start with a little bit of a recap, looking at the big picture again, and then we'll start working through the steps of building up the protocol. And so for our big picture and looking at what we've been talking about, this is the pieces cycle, and last time we talked about the proposal phase, and today we're going to get into the protocol. Next week we'll get into the production phase, which is where we're going to really focus mostly on searching and all the things that go along with that. Then the following session we'll get into the paper, and then our last day will be the other 4 plus talking about running a service. So each of these phases has the opportunity to have an output. Whether that's a formal or published output, it can depend on your team, but everybody should be doing a protocol. So last time when we were going through the proposal, we talked about the planning phase where you're figuring out which review type to do, you're framing the question, looking at related reviews, probably want to do a scoping search, kind of get an idea like how many's out there, and then figure out what's the rationale for doing this. So I just have a few slides kind of summary on that. We talked about different types of frameworks, and this is showing a few of those types. We also talked about how if you're doing a scoping review, that might have a kind of a different framework. So I put that one down here at the bottom. And we use this article, What Kind of Systematic Review Should I Conduct? That has a really nice table talking about 10 different types of questions and frameworks you can do with a systematic review. One thing I kind of talked through, but maybe I didn't say it explicitly, so I did put this slide in here. When you're thinking about, okay, I've looked for related reviews to the proposed question, what should you do? This kind of gives you a kind of a workflow in deciding if you found something that's already the same question, it's already kind of been answered in a review and it was conducted in the last 5 years, that's when you might have to change the question a little bit, modify something, or maybe you look at it and say, well, they didn't search all the places they could have. So there's probably something that you can do to continue with that question. It's just something you need to consider. Of course, a nice place to be is you find reviews that are close but not the same. Then you, of course, you're just referring to them and talking about them, but you don't have to necessarily change anything. And then with those reviews, those related reviews, you can look at what did they include, how did they search, look at their tables, things like that. And I kind of compiled this workflow from the article that you see here, which called for better integration of existing reviews into the current reviews. So just kind of asking everybody to look at those and comment on them and make sure they're part of the rationale for discussing the review. I had also presented this table, and some people had asked me to have the reference on there, and I felt bad that I didn't have that on there last time, so I provided it here. And this is just an example of what you can do with those previous reviews. This is to help your reader understand how did those previous reviews fit into the one that they're reading at that moment. And I think it's a nice thing to do. I've been able to include it in a few reviews I've done. And then kind of bringing it all together, we talked about, is this feasible? So while doing this proposal, did the question change? Did the criteria change? As they're working on this and trying to figure this out, proposals may be turned into dissertation committees or other groups to get feedback. So you kind of need to make sure that everything's still settled before moving on to the protocol. And so as they're changing their question, the eligibility criteria, you might be doing like an updated related review search, or maybe just kind of playing with that scoping search to try and figure out, oh, about how many items are we getting back? So I kind of wait until that's settled before moving on to the protocol stage. But usually the proposal stage is not a formal process, but I think working through it is very helpful. So in the next part, this is where you're starting to figure out, okay, what are the methods going to be? We're happy with this question. We think it's going to be feasible. So let's figure out this next part. And so the protocol stage, you're talking about what's our reporting standard? Should we register? Starting to design that first search, thinking about what databases should be searched. In some of the protocol registries, they don't ask for a lot on the search. Usually it's like a list of databases and maybe that first database search. We are going to get into the other items, and I think it's good to have an understanding of what those are and what your role can be in there. It doesn't necessarily, of course, most of the time I don't participate in those, but it's good to be able to talk with them about kind of what's required there. And there's a little bit of like data management, librarianship going on in there. Okay. So of course, the protocol is a blueprint. No matter what type of review you're working on, or if you're going to have it published, I would still have my team figure out their protocol before I'm going to go and develop the whole search. I found also that people are much more efficient with the rest of their review if they'll work on the protocol first with maybe say the first 50 or 100 items that come out of the search, work on the protocol, really build it up and figure it out. Because once they get into the data extraction part and see, oh, this is what I'm going to do, when they go back to start screening, they're much faster screeners because they have seen the whole picture. So one of the questions that I got in the Padlet was asking about the different places where you can register your protocol. And they also asked, how much hand-holding do you need to do with the reviewers? So this, of course, depends on your team. I, of course, will support them in the parts where I feel most comfortable with, right? Helping to frame the question, the databases, things like that. And some of the registration forms are going to be uh, much more spelled out what's required there. For example, Prospero is basically a form that you're filling out, while others may be more open. So I did list a few here. Excuse me. Uh, I'm most familiar with Prospero and OSF Registry. Uh, I've worked a little bit with Joanna Briggs Institute and their form, and I just finished one with Cochrane. BM, BEME is something that I've had medical educators want to work with. However, right now, the way they have their website set up, I think you can't see it unless you're a member now. So that's kind of unfortunate because those are a really nice place to go and look at. So a few things about Prospero. They only accept systematic reviews and only those that have some human health component. For the most part, it takes several months before you will hear back from them. It is not considered a peer review. They're mostly looking for completeness of their form for the most part, and they do ask that you not be in the coding or data extraction phase. So of course you will have had to work out and pilot it, but not be in the middle of finishing it up is what I can see. And the form is pretty straightforward. I think it can help to look at what's already been published in Prospero to be a helper. The OSF registry, this one is free. This one you can use for any kind of review. The format is really up to you, but there are some templates in there. One thing about it is that once you put your it in, you cannot change the protocol. Like you can edit things in Prospero and it just says like what was updated. It's also not peer reviewed. And there's thousands of protocols in there to go and look at. So to make sure that you're not doing something that's already been done or out there, you can always go and look in there. And I think OSF also has a few other registries in there that you could search at the same time. So there are a few myths that I hear often about registering protocols. And one of those is that you can't change anything once you submit it. Now, I just said that about OSF, and that's just because they locked that down, but that doesn't mean that you can't change things. In fact, to me, part of the reason why you want to register your protocol is part of scholarly communication. And maybe you get some feedback and there's something that you want to update. Remember I had a talk one time with a team and they said, oh, we've already submitted this and we can't change anything because I noted how their search was missing several things and it did not follow any standards of searching. And I said, well, you can't just keep going with a bad protocol with a bad search. So it's just one of those myths I hear a lot. Sometimes I'll hear, oh, other people will steal my idea. I've never seen this happen before. And I have also read that many journals have policies. For example, if they see, oh, this protocol was already, you've registered your protocol and somebody else was kind of swooping in and taking that, they have policies about that. I haven't gone into great detail about how exactly that works, though. And then if someone publishes a review on your topic, you can't. This happens a lot. You can continue. And like I said, there's many times when you can put your own spin on it. I've heard it said that, if you gave 10 different review teams the same set of articles, you could have really 10 different reviews. Now, that's not to say that you don't want to, be replicating things. You do want to bring in your own perspectives to it. So I see that there's been a lot in chat and there's some Q&As. So let's see what we can do here. For the informal protocols, would you recommend creating an in-house template? I think that can be helpful for them. It's basically saying things like, what is your framework? What's your eligibility criteria? How how does this relate to previous reviews? Those are like the main things that I would look for in there. Later in our the webinar, I will show you what's required from the Prisma P protocol. So hopefully that can hand out. And then let's see, are the recommended factors to consider when choosing where to register a protocol? Uh, so of course, there are things that you'll want to think about. Certain journals do ask for it to be registered in a certain place. Some are much more open that it just needs to be registered somewhere. Those are the main things. I think we're going to probably see over the next few years more places pop up. And so I wonder if that's going to become much more open than just having so few places right now. Let's see. There's any other. I see most of the talk was about rubric. Okay. Anybody saw any other questions I need to answer, just let me know. I'm mostly seeing about the handouts, so. Okay.
Um,
Did you see something else, Margie?
there are a couple in the Q&A. I didn't know if you wanted to.
Oh, there's some more in there?
You got the.
Oh, okay. The DM.
Yeah.
So this question is asking about the DMP tool. I haven't had a group that wanted to do that yet. Sometimes they have their own template. So I am very interested in trying it with a group. I have worked with groups that in order to fulfill a grant, they had to use a certain tool. So a couple was like SRDR, and sometimes it's been like another place where they had to put their data. And so the DMP tool, that's the data management plan tool where you fill this in. And I know there's one that's for systematic review. So I think it is useful. The best place for scoping reviews. So I had the fortune of being able to talk to Dr. Tricchio, who's one of the experts on scoping reviews, and she always registers hers in OSF. She prefers not to have them published because she doesn't want to pay twice for publishing reviews. So like an open access fee is what she's thinking about. So that's why she prefers to put them in there. So hopefully that helps you with that. Okay. So in our next part here, we're going to talk about selecting databases, designing your search, a little bit about evaluating your search, although I'm going to get a lot more into that next week. And then I'll have a little case study where hopefully give you a few minutes to try out a tool here in a search. So what makes this search different? I've also used this in presentations to talk about why they need to work with a librarian. So bias during the search is one of the biggest threats to a review as far as bias goes in the process. It will be evaluated by many people, of course. All the articles in the search that are retrieved must be labeled. And this is something that's really new for them, right? They've never had to do that before. They just picked what they wanted, and that was that. The search needs to be comprehensive. It is strongly suggested that only one database be searched at a time, and that's so that you can be the most comprehensive in each search. And it's this balance between sensitivity and specificity. So some words concepts we know we could add tons more things, but is it worth it to their topic? Things like that. And of course, the search has to be documented. And we're going to get a lot more into the search documentation next week. I just have a few suggestions for this time. I put this quote here. This is from the methodological expectations of Campbell. And the Cochrane has a very similar quote in there. And this says, searches for studies should be as extensive as possible in order to reduce the risk of publication bias and identify as much relevant evidence as possible. And so that's kind of what I always have in the back of my mind. But of course, it's always that balance, do they have time to go through 10,000? So it's a little bit of an art there. So in thinking about which databases should be searched, I almost always start with Medline, but it really depends on the topic and does that make sense for it? And then starting to list the other databases that I'm thinking about, I'll look at the previous or related reviews, lists from standards, which we'll talk about in just a second. And then you also think about important journals for that topic. And sometimes you may not be expert on what the important journals are. You may depend on your group for that. And then thinking about the scope of that database. So does that database include gray literature? Does it search conference papers, things like that? And then things about the differences in the interface and whether or not, do I want to search this in EBSCO or do I want to search this in Ovid? Like if you have options for them, thinking about that. So a few specifics. So the Cochrane Handbook suggests Medline, Embase Central, clinicaltrials.gov, and then the WHO clinical trials database. And then it kind of says, and any other relevant resource. So one thing that I like to have when I meet with clients is kind of a little list thinking about, is this getting into one of these other topics I have over here. So for example, we have our InMed program, which combines engineering and medical school together. And so I've been searching Compendex much more than ever before. Or maybe you get into, it's a psychology question. If your age group crosses over anywhere with school-age kids, and even into college, you might want to be searching ERIC for that topic. So I've also realized over the last several years how much there is about health economics in EconLit or even Business Source, especially around workers and health insurance. So just kind of giving that full picture because, of course, many times members of the team may be very kind of siloed in their thinking about where should they go search. So one tool that I use a lot with my teams, and I talked about this some last time, is using the Venn diagram. This helps me to make sure that when I'm anding and oring things that I'm doing it the way they're thinking about as well. And I usually like to kind of color code the sections of maybe a long search to kind of show where those are and where they fit. So Cochrane calls for these three concepts to be in the search: the population terms, intervention, exposure, those kinds of terms, and study type, but only if it's appropriate. For the most part, they would suggest not including outcomes in the search because a lot of times it's not available in the abstract. There are exceptions, and the case study we're going to look at today is an exception to that. So whenever I'm searching in a database, I try to think about what are all the fields where concepts may appear. So of course, title, abstract, subject headings like mesh trees, and then you've got your author keywords, which may be in certain parts of the record depending on the database. There are some other fields that you might think about depending on the database. There's like chemicals or organisms, things like that, that sometimes are important. I use this diagram to talk through with my clients as well so that they understand what I'm trying to do when I'm searching for the keywords and the thesaurus terms, trying to get them all in one place. Sometimes this can get complicated when you have mesh headings that cross over multiple concepts. We'll talk about an example of that in a little bit. But I'm just here just showing you some diagrams I use with them. And then, so the first thing I think about, and I think many people think about is okay, what are the best terms for this? And so you may have kind of your favorite place to go for your mesh terms. There's this mesh browser here within Ovid. So I know a lot of times I let Ovid map the term for me. Um, and then I'm going to also show you a tool called the Yale Mesh Analyzer, and that's what you could use. If you have already some known articles, you could use those to help you. For the most part, I do not use subheadings. So that's like if you were to go to a certain breast cancer type or something like that, and it might have subheadings like treatment or epidemiology, different things. I usually would not mark any of the subheadings because they can often be left off of an article, and so you wouldn't get many. It's also important to look at that tree in the mesh headings area and make sure, does it make sense to explode? I do explode most of the time, but only after I've kind of shown uh, my team, like, do all of these things belong there? Because sometimes they want to kick some things off. So this is the Yale Mesh Analyzer, and what you can do with it is you paste your PubMed IDs of some known articles into it, and then it helps kind of organize the mesh headings. And I find this to be really useful in working with the teams and talking through concepts or synonyms that they're suggesting. Uh, and we're going to have an example of this in a minute. And considering the terms I'm thinking about, I also want to think about, has it changed historically over time? When did that mesh heading start for that topic? So some mesh headings are very recent, and then you might need to see, oh, is there a heading before this one? And if not, that's going to make it much more important to put in as many synonyms, of course, as you can find, because we know that heading was just very recently added. And looking at the previous reviews, you can look to see how did they search for things. Of course, there's search filters out there, and some have been validated. Also, sometimes I also think about it is one of the terms we're searching for commonly misspelled. And Alzheimer's is one that comes to mind that I often see misspelled. So I've been wondering about how many, misspellings should I also look for? Uh, this is your chance to use all of those advanced keyword techniques. And depending on the platform, these may differ. So some terms you may want to do truncation on it. Sometimes you have those different spellings, British spellings, for example. And proximity searching, I find to be really useful for some topics. In my example here, I did put in computer addiction or informed consent. And sometimes you have different words in between those, or sometimes they can be in different orders. Limits is something to be careful about. And so I put a list of ones here that I usually caution people about. So one problem is sometimes people want to limit their search to adults. And this is complicated because a lot of times we don't see that term either in the title or the abstract, even though that is who they're working with. So that can be sometimes a difficult one. I would never just check the box for adults. I would always add in the keywords. But sometimes it's helpful to say to and in adults and then to not out children or something like that. Just in case it doesn't have either of those things in it. Geography is a very tricky one as well. So this is also one where it's rarely described if it's in the US in a similar way. So for example, they could talk about a region, a city, a state, a county. It's just so variable when you're trying to focus on a geography. Humans, I know most of you have probably heard this 1,000 times, but the human tag is very forgotten. Although in the example I'm going to show you in a little bit, it's actually on there quite often. So most of the time people say, instead of using the human tag, instead say not animals. Um, for study types, sometimes the tags in Medline are not correct. It's better to use search filters, and we're going to get in a lot into search filters next time when we meet. I'm trying to bring up like different features of the search this week, and then I'm going to give you a homework assignment, and then next month we'll see how you did with that. With the years, um, depending on what you're trying to do, some interfaces you can get down to the day that a record was added to the database, and some you have the month, and others it's just by year. So this can be a complicated thing when you're trying to update later on, but for now, it's just important to know like what year did that database start? And so that will give you an idea if you're deciding not to apply any year limits, how much you're searching. And like I said, next time we're going to get a lot more into validated uh, search filters. So when you're trying to document the search, especially here at the beginning, these are the important things to try and keep track of, especially when I'm doing this kind of searching. I do like to always save the search and give it the date so that later on I could see the changes that we made and put in notations about that, why decisions were made. Because sometimes it's hard to remember later on. It's really important, of course, to copy paste it somewhere. So even if I am saving it within the Ovid interface or EBSCO or something, I still like to copy paste it somewhere just in case I lose access to it. Many times you're also wanting to cite anything that you use to help you to build it up. So if you used a certain filter or you use part of someone else's search, I think it's really important to cite each other. I'm going to bring up a peer reviewing, but next time when we meet, we're going to talk more about other evaluations that you'll want to do of your search. But peer reviewing is so important and can be so helpful. Maybe you have a local group that you can share your searches with. The press is just one example of what you could do. Maybe within your own local group, you have a certain list of things that you want to get feedback on. But I think it is a really good starting point to do. So, okay. So here we have a case study, something for y'all to work on. I'm wondering if we shouldn't do a little Q&A before we get started on that. Let me see what we have here.
While Margaret's checking those out, I just want to point out that the handout that we're giving you the link to is one from introduction, but it still has a lot of good information that would apply throughout the series. So it is correct. It's just that we're just passing it on throughout the series. So just want to let you know that. But the slides are all individually tagged for each of these sessions.
Oh, thank you for that, Margie. So here's a question about Prisma P. So is Prisma P primarily for reporting a protocol in a publication? I think the answer is yes. I haven't seen one of the registrations using Prisma P, but I still feel that the Prisma P is useful in like what information should you have there, whether it's exactly in that order or if it's like something, I'm trying to say this a different way. So Prospero, they have kind of their handout that you're filling out. And so they don't necessarily have details within there, like what should you put for the search, where Prisma P gives you more details on what to put in different sections. So I think they can work hand in hand, but you're also right, and that it's primarily for it as a publication. I don't think that you have to avoid doing systematic reviews if you don't have MBase. It might be a limiter on your ability to find, I'm trying to, the biggest issue that you'll have without having MBase is it does index 2,000 journals that you don't see in Medline. It might be a little bit higher than that. And it covers pharmaceutical a little bit more. So I think the main thing to think about is what might you be missing out on. And it can depend on your topic as well. Um, um, oh, thank you, Kyle. Kyle's going to answer the one about the polyglot. Um, it searching for U.S. studies only is very difficult. The, there have been occasions, even though I suggested them not doing this, where I have said not, and I'll put in the other country tags and to try and help with that. But it's really difficult. And it's been a little bit since I tried to find a validated filter for US only geography. I've mostly seen it for other countries, but it has been a bit since I tried that. So maybe there is one out there. The spelling variations, I've heard some people say the Oxford Dictionary. I've heard people say things like that. I haven't seen like one place for finding spelling variations. Okay, so I do want to get started with the case study here. And so I tried to come up with a case study and give you some 6 articles to work with. And so what I'd like to do is to have you work maybe 5, we'll just do 5 minutes on this and kind of see where you get. So think about what might be the framework for this question. What other questions might you ask your client? What databases might you think about? And then I'm going to have Margie paste into the chat box the mesh tool that I have here. This is the Yale Mesh Analyzer. And she's also going to paste in a list of the PubMed IDs. So I just kind of ordered them all together. So if you do want to try the mail the mesh analyzer, that you could just click on the link and then copy paste those PubMed IDs right in to try it out. So we'll come, let's see, it's now almost 1:40. So I'm gonna mute myself for 5 minutes, let you kind of work on this, and then we're gonna walk through some of these things and see what you found. And we're going to keep using this as a case study, especially for next week, so that you can try out some of the other search techniques we talked about, and we'll share with you a search that was done on this and see, what did you find? So I'll come back in 5 minutes and we'll see what you think. Okay, everyone. I'm sorry, I didn't realize that the copying and pasting was going to be difficult. I didn't realize that you couldn't copy paste from chat. So hopefully you didn't get too frustrated with that. I just wanted to give you a chance to kind of think about this case study and perhaps try a tool if you hadn't tried it before. Was anybody able to use the tool and try it out? You can type in the chat and let me know. Yes, okay, good. What did you think about the framework for this question? You might need to talk with the client some more before you know exactly, but did anybody think of a certain framework it might fit? Yeah, the PEO, that's a good one. So in this case, they're looking at screen time as being an exposure, depression is their outcome, and then they have teens for their age group. And then the spellings of the age group, yeah. And what kind of questions would you want to ask the client, especially like around keywords or scoping of this? Yes, that's a really good question, Taylor. So what do they mean by screen time? Can it include video games? Like how far are they meaning that? Yeah. And the age range is also very important because teens can mean different things. Even if they're saying teens, they could still mean 10 to 19 or something. Um, yeah, so these are all really good questions. Okay. Um, oh, and databases. What did y'all think about databases? Yeah, and with depression, there's depression as a symptom, there's depression as a diagnosis, so that's important to know. So people including PsycInfo, great. Eric, yeah, because of our age group. These are really good. Um, just as a side note, PsycInfo is one of the most misspelled databases in abstract. It's misspelled more than 10% of the time, I have found. Okay, so let's kind of put this together here. So if you were able to do the Yale Mesh Analyzer, you could see something like this. Sometimes I do use this with clients to help them to understand their topics better. And so you see across the top the PubMed IDs, and then you'll see the very first item that I put in has no mesh headings. So it's probably a pretty new article, but sometimes it can take more than a year to get mesh headings added. You see there are some author-assigned keywords down at the far bottom, and so one term that's missing from the keywords here that you hope is somewhere in the abstract is something about the age group, because this just also there's nothing about screen time in there. So for this very first item, this very first column article, we would be looking more in the title abstract to have our topic. Then you see for the rest of these, we've got some good mesh headings in here. And this is where the question about, okay, what do they mean by screen time? Do video games count? That can make a big difference for those things that are not marked with screen time. So like the second item has nothing marked for screen time except maybe computers, which is a very broad term. The other ones all have some version of that perhaps. With the second one having just the third one has just internet. So that's also a very broad topic. Then we see video games, and then we start to see screen time. Another issue here is the age group. Really varies. We've got child here. This last one has multiple age groups on it, right? So here, this is where having that discussion with the team, finding out what their exact eligibility criteria is, and making sure, oh, do all of these actually meet your eligibility criteria? Then the search is probably going to have to be a little bit wider than what they gave you, right? Because of the video games, the TV type, things like that. Than just say, maybe just let's say screen time. Okay. So let's look at the next thing here. So I kind of put together a little Venn diagram there, started putting together like potential keywords here, thinking about like how everybody was saying for the exposure, the video games, computers, maybe television needs to go in there. Like how far are they willing to go? How many articles are they willing to sort through? And then we saw in some of the titles of the articles, it talked about instead of just depression, it said mental health or emotional health. Do they want those as well, or do they want to only stick with those that talk about depression? So all of these are really good questions and things to work through. I think there was even one that had young adult also marked in it as well. So depending on how they mean their age group, that can really expand. So one thing about this, um, and using this for an example is if you're an Ovid Medline searcher and you are searching for screen time, especially in those titles I gave you, there was screen time, screen use, screen exposure. There were several different ways of talking about screen time. The word use, if you're in Ovid, can cause a problem because it is called a reserve word. And so I did put a little slide in here. It's not often that I get to talk about this as an issue. It's just when I came up with this an example and I did my search, I was like, oh yeah, I forgot about that. So the in Ovid Medline and or not use ADJ, all of these things that are in bolded are words that it's an operator, so it means something. So whenever you're trying to search for the word use, if you don't put it in quotation marks, it will give you an error message. So it's one of those things you don't know until it happens to you. So I wanted to put that in here and let you know about that, what happened when you're trying to search for this. So one thing I thought maybe we could do for next time is I could present a search done on this topic for both in Medline and in PubMed. And so if you want to follow along and create a search that meets, has these 3 topics in there, then you can see how are you doing compared to what we came up with. You can also use these articles as your kind of testing against to see if they're coming up as you're developing it. Okay, let me see what other questions we have, and then we'll move on to the other parts of the protocol. So let's see where we're at. If you ask for someone to do peer review of your search, do you mention it or give them credit in the publication? I've only recently started really thinking about this, and I feel kind of bad for that. Maybe I should have been acknowledging people more often. I am thinking that they do need to be acknowledged somewhere, and I have been using dimensions a lot more, and they do keep track of acknowledgements. And so I think that that can be a good way to do this. And so in this case, I would include outcome of depression in the search, because otherwise, if you just had screen time and the age group, I think that would be way too many, and not, you wouldn't be able to sort that many things. Oh, do I always require the authors provide some key articles? I don't require that they have it for me. That can come out of the scoping search, but at some point we need to have at least a few articles that meet their requirements. So I don't require it before they come to see me, but hopefully in those first couple of meetings when we're talking through framing their question and related reviews, we need to get to have at least a few articles. So, okay, hopefully that answers your questions. And now we're going to get into part 4. This is all about the evaluating the results and what you're getting. Oh, sorry, my slides don't want to behave there. So these evaluation steps, this is where you're figuring out, and I talked to them when I talked to the team, I talked to them about building the factory of what are you going to do once you get everything. So they're going to be screening. This is screening things out by title abstract. This is all about relevancy, selecting my full text, sorting into actual studies, and we're going to talk some more about this, and then appraising and getting into the risk of bias. I put appraising here instead of in the data extraction, although they may do the appraising at the same time, because I do sometimes see groups where they're They do a certain appraisal where they kick things out at this point, but most of the time it is tied in with the data extraction, and that's fine too. The other thing that I did on this slide was I put down at the bottom what to call things, because as you're going through these steps, what you're working with kind of changes. And what I mean by that is when you're first doing your searches, you're retrieving citations. And citations are what you're putting into wherever you're going to do your sorting. When you're sorting by title abstracts, that kind of thing. I shouldn't say sorting. When you're screening, this is when you're doing title abstracts. So I usually just call those abstracts. The next part, when you're getting to the full text, those are like reports. The next part where I am using the word sort is this is where you're sorting your reports into the studies. So what I mean by that is sometimes one study could have multiple reports, but you're only working with the study itself. And I have more slides on this, so we're going to talk about it. And then the same is true for the appraisal phase. So in I'm sorry. So in screening, there's certain questions need to be answered for that. And this is to fulfill the PRISMA protocol format, but this also fulfills what they need to do in the final PRISMA as well. So how many people are involved? How are the citations divided? Any software? The disagreements. It's really important to pilot this, to screen a little bit at one time. What you don't want to do is have everybody kind of go off into their own corner and say screen 500 and then come back together. I've only seen groups have difficulties when they do that because usually there's so many that they're disagreeing on. So it's better to, at the beginning, do little bits and keep talking through. And what I tell them is the goal here is not to make sure that on every single thing you're always in agreement. The goal here is it's okay if you're in disagreement, but what is the underlying disagreement? Is it, oh, I thought we were looking for this, and that's why I said yes to it? Or is it, oh, we both understand exactly what we're looking for, but I think in this sentence they might mean this, so we need to look at the full text. Those are two different situations, and so it's just good to have them talking through. They may also come across something in that pilot that they weren't aware would be out there and might be an exception to their eligibility criteria. So it's important that they record that right then. There's lots of different tools out there. I know there's been papers written on how to use EndNote to do the screening. I prefer to use Covidence because we have a subscription to it, and it has a very low learning curve, but I've also used Ryan. I've used Abstractor. I've used Distiller. It depends on what you have access to, what your team is willing to learn about. It's just good to kind of figure out what is that tool going to be, and to pilot it and figure out and make sure it's working for everybody. For selection, this is where you're looking at the full text. It has very similar steps and things that need to be answered. The difference here is you've got to come up with those exclusion reasons so that everybody's marking them as you go through. I sometimes get questions like, how much do I need to read of this? And I usually just say, well, you need to read enough to know whether or not it's included. And it's okay if something kind of slips through here and goes forward to data extraction. If they start doing data extraction on it and they decide they don't want it, they can always send it back, right? Can always say, no, excluded. But of course, you don't want to do that too often. So I talked a little bit about this sorting before, where it's sometimes that sometimes one article or one study may have been reported in more than one article, but you don't want to do data. You don't want to double up on that study and have it overrepresented in the data extraction. This happens sometimes in things like Covidence. They do have a feature where you can combine things and say, oh, this is one study. the other thing that happens is sometimes the reverse happens, especially in animal studies where it will be one report, but it's actually 5 studies. Those 5 studies will need to be separated out. So a lot of times it's just one-to-one and they may not need a table like this, but sometimes they do and that's okay too. So in evaluating the risk of bias, like I said, this may be part of the data extraction process, but this is where you could have tools that they might want to think about. If they're only looking at randomized control trials, I would almost always suggest that they use Cochrane's tool. Um, but if not, if they have more than one study type, they're going to need more than one appraisal tool. And so other lists of tools that I've looked at is Joanna Briggs Institute has, I put kind of here, pasted in their list. And then there's another one that hasn't been out there for too long called Latitudes. It includes things that you don't see on Joanna Briggs. It does include the Cochrane list, and then you'll see other ones on here. So they have the reliability studies, prediction models. So there's different ones on here than you would see on Joanna Briggs. So I like to present them with a list of options to pick from and just talk through, what's available from that. Okay, so let's see how we're doing now. Okay. So does this searching happen while the researcher is building the protocol? So what I do for myself is I build a search, a decent search, and I say, here's the first 100 or so from that search. And then I talk them through what they need to do for the protocol. And I don't do any more searching until they build the protocol. That keeps me from running around and um, doing lots of searches on something. Maybe they don't ever come back. And so I like to make sure that I'm doing as much work as they're doing, kind of a thing. So I don't do any more searching until they're done with the protocol. And they may change things. They may change their whole question before they come back. So I usually wait to do any more searching. And that's when we get into the production phase next week, that's when the protocol is done. They're for sure going to do this. And now let's go, and get the search, the whole search done. I'm doing some of this work for the protocol because they need it to be able to report it or to put it into maybe a registration. So some work is done. For the screening, this is something that group is doing, so it's something that they need to figure out how they're going to do it and train up their team. That is part of building the protocol. So protocol isn't just something I'm writing down. I mean, you're writing down the steps at some point, but it's more of getting everybody trained on whatever tool you're going to use, figuring out those processes, and just really setting up their team. Now, for inter-rater reliability, that's something that's very rarely reported. There's only a few groups that seem to care about it. It seems like I do see it a lot in education reviews. I mean, basically, I don't think it matters that much. I don't know what the level would be because you just don't see it reported. I think the more important thing could be inter-rater reliability when it comes to risk of bias, but you never ever see that. So I'm sorry I don't have a good number for you there. I do teach teams how to use tools. Not every review service has the ability to do that. I think it is useful even if you don't use that tool, maybe you can help find them a resource on how to teach themselves how to do it or something like that. But I know not everybody has that opportunity to do that. I I am still trying to see like what's coming out. We do have a subscription to Covidence, and Covidence does have an AI kind of running in the background. They're adding more things, but I think it's constantly changing right now. So um, let's see. Okay, so critical appraisal risk of bias, most people mean the same thing. Um, so these are just tools for analyzing the methods of of a study to point out any difficulties with it. Um, so I hope that that helps. I think it's just people say it in different ways. For medical education, if they weren't a member of the AAME, I think is the name of the organization that helps to organize that, they could do it in OSF or something like that would be just fine. So not understanding that how much or the type of searching to do when they're working on the protocol. So the searches I do is I do the kind of initial searching where we're trying to figure out, oh, kind of how much is out there. Let's sort out your eligibility criteria. I also do the relevant review search. We might, change that search a little bit depending on how they settle on their eligibility criteria. And then at some point they're going to say, okay, this is my eligibility criteria, and I designed a search for Medline, but I only give them the first 100 to 200 of those results. And the reason why I do that, and I don't do very much more searching, is they need time with those results. If I give them, let's say the total result from Medline was 2,000, they tend to want to screen all of those things, and they'll just focus on that part of it instead of actually building their protocol. So I do try to slow them down a little bit and say, build your protocol. I promise this will work. And most of the time the teams understand that. I've just been doing this a long time. I've seen the pitfalls that happen when you don't do that. We're going to get into all the translating. We're going to do all of that next time we meet. So, and yes, I do only do one while they're doing one search while they're doing um, their protocol search. So let's go ahead and I've got 20 more minutes and a few more slides here. So I do want to talk a little bit about the coding form. And this is that data extraction part that I said they might combine both data extraction and appraisal together. So very similar steps to what you're doing with the screening and everything. They need to kind of draft it, develop it, pick the software they're going to do this in, pilot it, and then go from there. So this is where they have to decide the characteristics that they're going to code from each study that they're going to include. And so hopefully kind of seeing where now I'm talking about studies instead of abstracts and things like that. It's a very similar idea, how many people are involved, how they're going to divide it up, what software they're going to use. Sometimes people do ask me like, well, what should I put in there? There is a list of things you can get from the Cochrane Handbook. Now, of course, Cochrane mostly focuses just on intervention studies, and so that won't necessarily make sense for a group that is looking at different types of studies like observational. Sometimes I also tell groups like focus on what you're interested in there, right? So even if you have a reporting standard for that study type, which you can get from the Equator Network, there still may be something else that they're interested in. So maybe it's a certain definition of, maybe they want to know, well, in the last 10 years, how has the definition of screen time changed or something like that, right? That's going to be you're coding that differently if that ended up being a part of the question they wanted to answer in our screen time example. So the Equator Network, I thought I had a slide on the Equator Network. Sorry. The Equator Network is an online resource that keeps track of reporting standards. So let's say they're looking at just survey studies or observational studies, um, different types of studies. You could go in there and find the reporting standard for that type of study, and that would list out the things that you need to include. Just like we have Prisma for what should be included in a systematic review, there's other reporting standards for different study types. So that can help to get them started on what to do for that. But of course, if they are having lots of problems, like if it was a graduate student, I would refer them to go back and talk to their committee, because of course I'm not going to be expert on their topic enough to suggest other things. So how should they do the data extraction? So this is where some groups want to use a spreadsheet. I very much do not recommend doing that. It becomes much harder to keep track and make sure that things are they get distracted by the other rows and it's easy to mess up. I have used Google Form or Qualtrics before. And then there's, of course, review software like we have Covidence. So here it's like, what do you have access to? What do they feel comfortable with? Things that are not review software, they're not going to help with the fact that you're supposed to have at least 2 people coding everything and then combine those answers together and reach consensus. So it's going to be a little bit more complicated if you're not using review software, but it can be done. And it's really important to pilot those studies. I would test with at least one. I suggest maybe more than one. And especially if they have different types of studies in their review, like a lot of times in scoping reviews, you have several different types of studies could be done. At least have a few examples of those different types of studies in there. We don't really have time to talk about this too much, but this is an example form that I just wanted to show and talk about maybe some of the issues that are here. Yeah, I think we have a few minutes. We could do this. So this is, sometimes I will see people ask me to look over their data extraction form, and I tried to put in some examples of things that I would see. So if you had a client that showed you this kind of form, what are some things that you would suggest based on this? Do you see any issues with any of these questions? Jenny, what do you mean by inclusion-exclusion criteria? The pick one age group, yeah, that could be a problem if it covers more than one. So sometimes I'll see people with a question and they don't they don't let you have multiple options there. Yeah. Yeah, and that's a big problem. Sometimes they have the mode of the survey is different than the type of a survey. Yeah. So for methods, if you just had like, what were the methods question, that's just going to be something where they would type in like maybe a paragraph. That's not distinct information. And that's one of my biggest suggestions to teams is you're going to have some open questions. You can't help that. But for the most part, you really need to have each question you're asking have distinct information in it. Otherwise, it's going to really slow down your analysis at the end, because that what were the methods part, it's going to be all over the place and you're not going to be collecting the similar information from each one. So I tried to put some really bad questions in here, so y'all are calling them out, so good job. Yeah, behaviors could definitely be, it could be like a checklist and then have I don't think that they should have that as an open question here. So, so y'all are really getting it here that these are bad questions. They need um, this needs a lot of work. I do see aim of study a lot on data extraction forms. Most of the time, they're just pasting in something from the journal article. It's not really very useful. I think it's better for them to think about what is it they're really trying to ask with that and figure out how to ask it in a different way. Um, but yeah, so I just gave y'all really, really bad questions here so that y'all could point those out, but y'all did really good. Okay. Um, yeah, and thinking about the outcomes they're looking for and then working backwards, that's also really good. Okay. Um, so when I'm thinking about the form, uh, it's important to think about not everything you think will be reported is reported. So you may need not reported to be an answer for some of your questions. Um, it's always good to have them pilot it, fill it in, and then look at the tables and things that they could get out of it. Sometimes that will help them to kind of figure out, oh, this isn't a good question, or I need to do this a different way. Um, that really can help. Sometimes they need an NA in there as well, and it's good for them to meet on some regular basis. Now, of course, these are just things that I suggest to them. I can't regulate any of that, but I do try and give them some, hints on and tips as we go forward. Okay. So bringing it all together. So Prisma P is a standard for reporting your protocol. If you want conducting ones, you can look to the Cochrane collaboration, Joanna Briggs, Campbell. Um, it doesn't include results, so that's not a part of it. And it provides the items and the order of the information that needs to be there. So I divided this into a few parts here, and I'm just going to have one slide in between these, kind of give little tips as we go through. So this first part is really like, who's involved in this? What is the title? Was this funded? Was it registered? All of those kinds of things. And so I use this checklist when I go and talk to like faculty or something. I'll go through this and say, I can help you with registration. I can help you to try and find funding, things like that. So I use it to help me to organize my talks with people. And then in the next part, you get into that rationale. So remember, part of the proposal was to figure out that rationale. So that is a part of the protocol as well. And what's their objective, which that usually includes the framework. Get into the eligibility criteria. What are the databases that are going to be searched? And number 9, a search strategy for at least one thing. And then you see you getting into the data management. And this is where somebody was talking about the DMP tool. That's something that I could get added into our resource list. That would be a good thing if you hadn't heard about that one. But they need to describe how they're going to manage the data. Usually this involves what software they're going to use, but depending if they're getting a grant or something, they may have to post their data in a certain place. Then you see 11B, they're starting to talk about selecting studies and that screening part of it. And so here, that rationale, I was just getting back to, that's what we talked about in the beginning. They could have a table for that. They could show where their review is going to be different. And then this is the last part of Prisma P, and this is where you see, okay, what is that data collection process going to be? And what are those items? And that's just listing those. Somebody had said, oh, you really should focus on the outcomes. And so Prisma P really does call for listing those out and making them very clear. You have the risk of bias here, what's going to be done with those. And then it has a section all on data synthesis. So a lot of times people are going to do like a qualitative synthesis, but sometimes they are going to get into the meta-analysis. And of course, that's where my skill set ends, and I send them to go and talk to somebody else for that part. So you can see how it's really following, building up that factory of what are you going to do once you download those citations and how are you going to sort them out? And by encouraging groups to really work through this, when they get back to the beginning, they're much faster at screening. Everything goes so much more smoothly if they'll let this process work it out. Now, of course, not every group will go through the Prisma P and totally write out everything, and that's fine too. What my requirement is that they've worked out their data extraction, their appraisal, and of course their screening as well. Once they have that worked out, then I go ahead and work with them on the next parts of the searching. One item that's on that list is grade. This is something I've never had time to stop and do any training on, so I'm just describing here like what it is. This is how, especially with Cochrane, they suggest rating the certainty of evidence in systematic reviews. And there's free resources on Cochrane's page, and there's it goes through about how to do this. It's basically once you've done the appraisal of the articles, how to take that information and give a rating to the evidence. So I just wanted to kind of spell that out there, and where there's more resources that you could guide people to. That's all I've ever been able to do, is just tell them where it is. Okay, so let's see what questions you have. Now we're down to the last 6 minutes here. Oh, when I say coding, I call it coding because that's how I was originally taught it. Sometimes people say data extraction. This is basically where you're taking the information from each article and putting it into kind of a form that you have created. So I'm sorry that I am using that word. And that might not be how everybody says it. Let's see, what else do we have here? So the next time we're going to be talking about production, and like I said, this is where we're really going to be getting into the search itself, talking about how do you take those original articles they gave you and you're testing the search. We're going to talk about translating searches. We're going to talk about deduplication, and then the fun part, getting into gray literature. So if you want to try and create your own search based on our case study, that'll be great. I'll be presenting that next time. And thank y'all for joining today. I know we went kind of quick. I promise next time we're mostly going to talk about the search, and we're probably even a little bit in the next one after that. But hopefully these tools are helping you. Oh, thank you, Peter. Hopefully my voice has held up okay for y'all.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.